Let's get over to the phones because each and every Monday throughout this pandemic, we've been spending some good time with our friend, Dr. Dennis Norem from Mercy Health, discussing the COVID-19 pandemic, where we are with it, what's going on with it, and where we see ourselves going. Dr. Norem, good morning.
Good morning to you guys.
You okay after the Super Bowl?
Yeah, I survived it. I really didn't have a team that I was rooting hard for, but I was hoping for a little better game.
I think we all were.
Yep. Yeah,
I think we all were.
I think we all were, but it's one of those things I always enjoy the day after the Super Bowl when I'm reading, if you got a bad hangover, you should try this. A good hangover cure would be, I don't have any of those problems this morning whatsoever.
It's good.
So.
Well, that's good. My concern is, though, that it may be a bit of a spreader event. As you saw the crowds and the celebration afterwards, people had masks on, but most of them were on their necks, I think.
Not even afterwards, but Tampa was quite the hot spot in the couple nights leading up to the Super Bowl. So
yes, those parties were like the parties we saw over the holidays. Not a good situation. The only good news is it's basically 1 or 2 days, and people are gone. So hopefully it won't cause that much of a problem.
Maybe you would know the answer to this one, though I still do find it surprising knowing that each and every player, member of each staff, coaches, everybody else, they're tested day in, day out, and they go out there for the game, and, the coach has to have a mask on the sidelines. Why is that when everybody who is on that field ostensibly has been tested even right up to game time?
Well, again, we don't have data to know for sure. If you're tested negative, does that mean you can't spread the disease? And along with that, even if you've been vaccinated, you may still be able to spread COVID to other people. So in spite of the fact that we're vaccinating people, in spite of the fact that we test people day after day, you could still be spreading the disease and test negative.
All right. Yeah, that one had never occurred to me.
And it's just probably a good visual for everybody to see.
Enough with the visuals. I'm so sick of visuals.
Are you, Riles, are you not concerned about the optics?
No, okay. I'm really not. I'm really more concerned about the testing and people getting vaccinated, that sort of thing, rather than the visuals that really don't do a whole lot of anything for me.
Right.
That's why we asked Dr. Norem these questions, because here's someone who knows and not just, guessing like I am.
Me too.
Yeah.
Yeah, and again, we want people to get tested, no question, and the testing is very important, but it doesn't negate the fact that we need to continue to do the distancing and being safe and wearing masks until we really get beyond this pandemic.
What's your thought on Johnson & Johnson? They have submitted a single-dose COVID-19 vaccine candidate to the FDA for emergency use authorization.
Well, that's encouraging. As it's been shown, it may not be quite as effective as Moderna and the Pfizer vaccines, but it is a single dose. It's much easier to administer and store and distribute, and it's still fairly effective. It looks like it's in the 70 to 80% range with one shot, which is quite good when we compare that to our flu vaccines, which typically have only been in the 50, 60, sometimes less percent effectiveness. So that's very encouraging. Having more vaccines is a good thing.
I know a lot of times I ask you these questions, and you started off with, well, I'm no virologist, but I do want to ask about the single dosage and two-dose shots. Now, we've been told, or from what I understand, the two-dose shots are the same shot, just one kind of covers up what the second shot kind of covers what the first shot missed, as far as I understand. What if this Johnson & Johnson shot, isn't as effective as the other ones, but it's only a one-dose shot? Why wouldn't putting a second dose on top of that make it more effective?
The only way I can explain that is that sometimes, depending on the mechanism of stimulating the immune system, giving 2 doses of something is more effective. And I'll go back to the shingles vaccine. That's a 2-dose shot as opposed to, say, your diphtheria tetanus shot. Well, there's another example. Your initial diphtheria tetanus shot is a 3-series. So we found by testing that depending on the virus, you sometimes need to stimulate the immune system a couple of times with an interval in between, whereas other shots, you only need to give one shot to stimulate the immune system, and you get as good a response with one shot as you would with two.
And then just to clarify, make sure I'm not wrong on this, with the two-stage Moderna and the Pfizer, those are the two stages. You're getting the same vaccine. There's not, the second one's not boosted with something else or something like that,
Correct.
right?
It is the same. It is the exact same vaccine.
Yeah.
All right. Yeah, that's one of those things. When I looked at Johnson & Johnson, and they say, well, the one thing about theirs is that their efficacy isn't quite what the others are. And you mentioned 70 to 80%. That's exactly what they're talking about here. 72% effective in the U.S. against protecting against the virus, and it apparently varies from country to country. 72% effective domestically. That drops to 66% in Latin America and 57% in South Africa.
Well, and again, depending on where you're located in the world, the strains are different, as we've seen. We've talked a lot about the mutant strains, and I did see one thing pop up that in South Africa, that strain may be more problematic. They were rolling out, I believe, AstraZeneca's vaccine, and they stopped giving it, finding it's not very effective against the South African strain.
Yeah, the new coronavirus, I'm looking at a thing from studyfinds.org this morning saying the new coronavirus variant doesn't cause worse infections or lead to more deaths. That, according to them, researchers from the Public Health Department of England and the Centers for Disease Control and Prevention.
And I think that's the UK variant, which I see that is now in Region 1. It's been reported in Lee County, and which has been expected. It's expected that the UK variant, which is more easily spread, is going to be the dominant variant here, actually the dominant virus here in the next probably 2 to 3 months.
Is there any chance with one of these dominant mutations or variants taking over and we're kind of back to square one with this whole thing?
I don't believe so. There isn't that concern yet. I think that experience in South Africa with their variant is a little bit of a concern. There's some evidence, again, that the AstraZeneca, which is a one-shot immunization, is not as effective, and they've kind of backed off, and they're trying to figure out what to do. It's possible that also may be more likely to reinfect people who've already had the initial coronavirus. On the other hand, the UK variant is more contagious, so it's probably going to become the dominant variant here in the United States, and we think that our current vaccines are fairly effective against that. And as you've just mentioned, it's probably not more deadly than what we've already experienced. So we're probably okay. I don't think anybody's sounding the alarm bells that we're going to get this new aggressive variant that's going to get us back to square one.
When we talk about the vaccines and who's getting them and all that, how would you grade, at least let's go with locally, how would you grade Illinois' rollout of that vaccine, and what is it we can do to improve what's going on with it?
Well, apparently we're not doing very well. There's a good article by a couple authors from the Tribune that's on the internet. I think you can get it through the Peoria Journal-Star, and it's a good summary of where we're at. We're kind of in the bottom. We're ranked about 45th, 46th in our rollout, and it's not clear exactly why we're not doing quite as well as other states.
Real quick to interrupt, 45th, 46th, based on what metrics?
I think based on the number of shots per capita in people's. I think everybody points to West Virginia as kind of the best example of a state that's really done well in terms of their rollout. They're able to get the vaccine quickly into the arms, and per capita, they're doing quite well. And apparently, they did much better planning ahead of time. They use the National Guard to help plan and distribute. So I think part of the problem in Illinois is you have a large metropolitan area, Chicago. We have a lot of rural areas, and this gets back to the problem we've already discussed. We've let our public health structure to a large extent. We haven't supported it. It just doesn't exist to be able to use to roll things out. Now, having said that, I think we're doing better here in Winnebago County in terms of the coordination between the health department, the major health systems, in terms of getting the vaccines into people's arms.
Yeah. So what are we lacking here in Illinois? Are we lacking supply? Are we lacking getting it to places? Are we lacking people to administer the shots? Which one of those would you fix first?
I think you have to fix all of those things. But I think a lot of it, again, was people were just not able to plan well ahead of time to have things ready. And that depends on where you're getting the vaccine. For instance, I think now here in Winnebago County, the health department is working with the major hospital systems. And I think they made announcements about 10 days ago about how they're going to do that they can get 1,000 doses a week. Each system will get 1,000 doses. Crusader gets something like 500. Some of the other smaller healthcare providers get some of the doses. So as soon as the doses come to the county, they're dispersed fairly rapidly. Well, it's taken until a few weeks ago to get that system going. And you can see that probably would have been good to have our system all planned out 3 months ago, 4 months ago, waiting the vaccine. So it's a problem, I think, at all levels. Just trying to coordinate and trying to figure out, who gets it, where do they get it, how do we do it, and then the problem is just logistics. You can see across the country that we're finally figured out that we need to use stadiums to be able to get the people through quickly. So it's really a problem at all levels.
Dr. Norem, much has been made out of the White House spokesperson saying the other day that even after everybody's been vaccinated, we let's assume that we hit 100% numbers and we get everybody covered with all that. The need for masks and social distancing will remain long after.
I think that's probably true. We're going to have to get to the point of herd immunity, and that is unclear how long it's going to take. Some people think we can accomplish that within a year with vaccines and the natural disease. Other people are not so sure. They're saying maybe it'll take a couple years to get to that point. Until we get to significant herd immunity, we're going to need to do the masking and the social distancing.
We're talking about masking, social distancing, and you mentioned it earlier. Testing is still something that we need to think about. I think that has escaped people's minds. Once a vaccine has been rolled out, we feel a little bit safer. So finish the sentence. Somebody should get tested if
they have any concern about any of the symptoms of COVID, which include, and you can go online, obviously, and there are symptom checkers, but it's basically fever, cough, congestion. It could be diarrhea. It could be none of those symptoms. If you have any concern that you've been exposed to someone who has COVID, who has those symptoms, go get tested. There's nothing wrong in being over-tested. So I would encourage anybody that has any concern to contact their provider and get tested.
Should somebody that's received one or two of the vaccine shots already think about getting tested if something is not feeling right?
Yes, that's a good point. Even though myself, I've received both doses of the vaccine, I can assume that I have immunity. I could still get a mild case. There's no question that that can happen. And if I have those symptoms, I will need to get tested. Because if I have the symptoms, I get tested and I'm positive, I need to quarantine myself, obviously.
And do we know how long? I'm sure this question has been asked multiple times, but let's use you for example. You've had the full battery of shots there. How long does that purported immunity then last?
Don't know for sure with the vaccine. I don't think we have enough information. Looking at people who have had COVID, there's just recent article said that it looks like they have good immunity upwards of at least 6 months. So we're hopeful that with the vaccine that we'll see the same kind of immunity at least 6 months, hopefully longer. But I just don't think we have the data. I think for now we can say probably we're good for at least 6 months.
Do you see another rollout of a vaccine starting next year for people that have already had it?
I think a lot of that will depend on the information that comes back in terms of immunity, and some of that will depend on what happens with these variants, these mutant variants. as you, or as I think we've already mentioned, I think Moderna and I believe Pfizer are working on boosters that would specifically target some of these variants. So that's probably the direction we're heading. We may get booster shots that have a slightly different target in terms of the variants.
All right. Well, something to look forward to down the line. Boy, I really enjoyed that shot. You might get a chance to get yourself an encore on that one. Dr. Norem, as always, we appreciate the time. We appreciate the expertise and how you've been with us every step of the way throughout this pandemic. We'll look forward to picking this up again with you next Monday.
All right. Sounds good, guys. Take care.
We appreciate it. Dr. Dennis Norem from Mercy Health.